right, great. Good morning, everyone, and welcome to Mecklenburg County 2021 Open Enrollment Session. My name is Wanda Caldwell, and I am the HR Benefits Manager. Assisting me today is Ms. Madison Little. She'll be serving as our Zoom producer and moderator. Madison, would you like to say a few words?
Sure. Good morning, everyone. Throughout the presentation, I will be monitoring the chat box. So as we go along, please enter your questions into the chat box, and I will try my best to ask them throughout the presentation. We will also have our vendor representatives on the line. So if you have a question in relation to our vendors, such as CVS or United Healthcare, Blue Cross and Blue Shield, we do ask that our representatives answer those questions if you can. And feel free to ask questions to me privately or to everyone in the chat box.
Thank you, Madison. Also joining me today are several HR teammates, and as Madison said, our external business partners to help answer any questions you might have. So I'd like to take a minute to introduce them. From HR, we have Senior HR Manager Jennifer Moretz. From the benefits team members, Sarah Landis and Courtney Monzak. From the Employee Services Center, Ms. Sherry Lowe. And from Blue Cross Blue Shield, we will have Ms. Portia Judd, or I believe Jasmine Walden. CVS, Mr. Bill Library. Cigna Dental, Ms. Beth Barnes. From United Healthcare, Carmen Abernathy. And from the Our Health Clinic, Ms. Jenna Ewing. Today's topics are a result of feedback HR has received from employees. Some employees say they don't really understand our medical plans. So the objective for today is twofold. First is to help educate you at a high level on the medical plan options. And second, it is to share with you what's staying the same for the benefit plan year 2021 and what's changing. Employee benefits can be confusing. We have over 25 different benefits to offer our employees. I think all of them are great. I can't go over all of them today, but I will spend some time on medical plan options, understanding a high deductible health plan with a health savings account, review the dental and vision plan options. Then I'll talk about what's changing for plan year 2021 and what's staying the same. I'll point out the value of Our Health's clinic and how it complements the medical plans. I will also highlight the voluntary benefits that you may want to consider doing open enrollment. Then we'll wrap it up with some Q&A. I want this to be your meeting. So if you have questions, please put them in the chat box and we will pause periodically to address them. You will also have an opportunity at the end of the session to ask questions. Your questions are important to us because this session is being recorded and we have over 100 participants. I ask that you compose your questions in generic or general form. And please, please refrain from giving out any personal or private information. If we are unable to answer your question during this presentation due to time constraint or content, please reach out to the appropriate insurance carrier or the Employee Services Center for assistance. Let's start with something simple, like the acronyms we use today. PPO, HSA. These are the two acronyms that we use within the county when we're referring to our medical plans. But do you really know what they stand for? PPO stands for a Preferred Provider Organization Network. HSA stands for Health Savings Account. And that's what we've been calling it. But actually, it's a high deductible health plan with a health savings account. We recognize that this might be adding to some confusion when explaining the two. So going forward, I will call the plan what it really is. It is a high deductible health plan with a health savings account. For comparison, I've tried to capture the main difference between the two plans. On the left-hand side of your slide, you see the high deductible with a health savings account plan. This plan has a high deductible, lower premiums, an HSA tax advantage savings account, and co-insurance. On the right-hand side of the screen, you have the PPO, which has a lower deductible, higher premiums, a flex spending account, which is a tax advantage account that is optional, along with co-pays and co-insurance. During open enrollment, employees hired after January 1 of 2017 are offered the high deductible health plan with the health savings account. Employees hired before January 1, 2017 will have the option of selecting the PPO or the high deductible health plan. There's not a one plan better than the other plan. Medical and pharmacy coverage are the same for both plans. However, the mechanics of the plans are very different. The PPO plan is a copay type of plan. And you might ask, what is copay? Well, it is a set cost for doctor visit, prescriptions, and other types of care. Currently, the copay is $25 for a regular doctor visit. What is a deductible? A deductible is a set amount you pay for the medical services or prescriptions before your co-insurance kicks in. What is co-insurance? Co-insurance is a percentage of the cost you pay after you've met the deductible. For example, the PPO plan today for the 2020 plan year, you pay a copay of $25 for a regular office visit and a $40 copay for a specialist visit. The deductible is $600 for individual coverage and $1,200 for family coverage, as well as a co-insurance of 20% after the deductible is met. The high deductible health plan is a qualified medical plan as defined by the IRS with a health savings account. The medical and pharmacy coverage is exactly the same as the PPO. The mechanics of the two plans are different. Here is an example of how it differs. With the PPO, you pay that $25 for a typical doctor visit. With the high deductible health plan, you must pay the total cost of that doctor's visit until you meet your deductible. So if the doctor's visit is, let's say, $100, you would be expected to pay that $100. Remember, I said the high deductible health plan has a savings account. The health savings account is a tax advantage bank account that you own. The funds in the account belong to you and they stay with you even if you were to change medical plans or separate employment with Mecklenburg County. You and the county may contribute pre-tax dollars into this health savings account during the year up to the maximum allowed. For plan year 2020, the annual maximum is $3,550 for individual coverage and $7,100 for family coverage. For plan year 2021, the annual maximum is $3,600 for individual coverage and $7,200 for family. High deductible health plans are free from federal income tax, and in most states, free from state income tax as long as they are used for qualified healthcare expenses. To understand the components of the high deductible health plan, let's take a look at the diagrams from the bottom up. First, there is the high deductible health plan itself that's established by the county. The money, or as we sometimes refer to it as the seed, is contributed by the county. Second is your share. This is the money you pay with personal funds, or in other words, your employee contributions. We encourage employees to make contributions to help pay for medical expenses at least to the $1,600 or the $3,200 deductible. The funds in the health savings account are owned by you and roll over each year, unlike the flex spending accounts. So if you would rather save the funds for future expenses, you can do so, or it can be used to help offset the deductible. After the deductible is met, you and the county share in future costs. This is the coinsurance. You are responsible for 20% of the cost and the county the other 80% until you meet the annual out-of-pocket maximum. Once the out-of-pocket maximum is met, then the plan pays 100% for all expenses. Just remember that all preventive care expenses are always covered at 100%. You might ask, does pharmacy expenses apply to the deductible? The answer is yes. Both medical and pharmacy expenses apply to the deductible and out-of-pocket maximum. That was a high-level overview of the medical plans. I'm going to pause here to see if there are any questions. Madison, do we have any questions in the chat box?
Yes, we have a few questions. The first question says, I have a question regarding cost premiums. We're told that there are no increases for medical and vision. However, there is reduced coverage to 75 and 25, as well as increases on the back end. Why not increase the premium and leave out-of-pocket costs the same?
That's a loaded question.
Hey, Wanda.
Wanda, hey, Jennifer.
I'll pitch in and help you out there. Madison, if you could please get that employee's contact information and I can reach out to them and have a discussion with them. It's kind of an involved answer and it's a little too long for this forum.
Will do.
Thank you, ma'am.
No problem. Let's see. So our next.
I have a question. Hello?
Yes.
This is Merlin. I have a question for Mecklenburg County HR. I just want to know why Mecklenburg County does not offer adult orthodontists.
Oh, I believe we have our Cigna Dental rep on the line, Beth. Can you respond to that one?
Absolutely, yes. So under the dental plans through Mecklenburg County, For orthodontics, the county made the decision many years ago to cover orthodontics for dependent children only up to the age of 19. I will tell you, in general, most employers do not cover adult orthodontia. It's just typically it's not a common benefit that you see that employers offer for adults. But just know that even though it is not covered under the dental plans for the adult, if you are enrolled in the HSA plan, you can use your HSA dollars to pay for adult orthodontia, or if you're enrolled in the PPO plan and you elect flexible spending accounts, you can use your FSA dollars to pay for adult orthodontics.
Thank you, Beth.
Thank you. I have another question. What if you have the third plan? What covered under the third plan? The dental third plan?
Yeah, there's only two dental plans. There's a standard dental plan and an enhanced dental plan.
The enhanced one.
Yeah, the enhanced dental plan. So the network of dentists that you can choose from is the same regardless if you go on the enhanced or the standard. The biggest difference between the standard and the enhanced is this enhanced plan does cover orthodontics for dependent children to age 19, where the standard plan does not. The other differences is that with the enhanced plan, your dental calendar year maximum is $1,500 versus $1,000, and your dental deductible is less, which is $50 versus $75 on the standard plan. But other than that, the plan is pretty much very much similar to the standard plan.
So let me jump in here. Thanks, Beth.
Sure.
Thank you.
Let me jump in here for a minute and remind the participants that we have over 100 people that have joined us today. So if you have questions during the presentation, I would like for you, I ask that you put the questions in the chat box. That way we can manage the questions, answer them when we get to a good place and not delay the presentation, because a lot of this information is still to come. We are going to cover dental and vision and some other plans later in the presentation. So if you have your questions, your immediate questions, please put them in the chat box and we will respond to them. All right, so Madison, I know you said we had quite a few in the chat box right now. But let's hold on to those. We'll get to them. Can get to them at the next break or at the end of the sessions when we have our Q&A. All right. So we just went over at a high level the medical plans. Now I want to talk about the dental and vision. Both dental and vision have two plan options to choose from: standard and enhanced. The dental plan is administered by Cigna. As Beth said, with the standard plan, you must go to an in-network dentist. The calendar year maximum is $1,000 per individual, and there is no orthodontia coverage. However, under the enhanced plan, you may go to any dentist. The calendar year maximum is $1,500 per individual, and orthodontia is covered with a lifetime max of $1,500 per individual. The vision plan is administered by United Healthcare. Both plans offer eye exam every 12 months and frames every 24 months. The standard plan has a $10 copay for eye exam and a $20 copay for materials. With the enhanced plan, eye exam and materials are free. Now, let's take a look at what's staying the same and what's changing for the 2021 plan year. Good news, no new carriers this year. Employee medical premiums are staying the same. Vision premiums are staying the same. Employees and their covered dependents will continue to have access to our health clinic. What's changing? Employee premiums for dental insurance are increasing slightly. For the medical insurance, the out-of-pocket maximum is changing to $5,000 for individual coverage and $10,000 for family coverage for both the PPO and the high deductible health plan. Co-insurance on both the PPO and high deductible health plan is increasing to 25%, up from 20%. Urgent care copay on the PPO plan is increasing to $60, up from $25. Prescription copays on the PPO plan are increasing slightly from $10 to $15. Lastly, the county's contribution to the health savings account is decreasing. For employee-only coverage, the county will contribute $750. For family coverage, the county will contribute $1,500. Even though the seed is decreasing, it is still a very generous employer contribution. Many organizations that I've seen offer much less than that. Are there any questions about what's changing and what's staying the same for the 2021 plan year? Madison, do you have any questions in the chat box related to the change?
Yes, so I do have a few questions, general questions. Why does the county not offer the PPO to those who are hired after 2017?
Well, that's every year. Let me start with this. Every year, the county manager is presented options to consider, and these options are considered. We HR department, the benefits department, work with an outside consultant to take a look at our trend, our medical trend, and our budget. As you know, we go through a budget period every year, and so there are times when the budget and the cost, the high healthcare costs, has to be looked at. How can we manage the high healthcare costs as well as the county's budget? And so there are options for the county manager to consider in order to manage it. And several years ago, this was one of the options. And also, it's a growing trend. There are more companies have moved to a consumer-driven health plan. And a consumer-driven health plan, one of the options is a high deductible health plan. So long story short, it was a way of the county trying to manage its high healthcare costs. And it also creates a cost sharing where the employee as well as the county can share in this. And for lack of a better word, I'm going to use the word burden. The healthcare healthcare cost is outrageous. As we all know, the cost for healthcare is astronomical, and it's a way that both the county and employees share in those costs. Madison?
All right, so our next question would be, can I use my dental insurance as a secondary for my husband?
I'll take that, Wanda. Yeah, so this is Beth Barnes with Cigna. So great question. You can, but just remember that when determining which plan is primary, the birthday rule will be used. So for example, to make it easy, if your birthday is in March and your spouse's is in April, then your plan will be primary and your spouse's would be secondary. So just keep that in mind. But yes, you can have dual coverage, and coordination of benefits can apply.
Thank you, Beth. All right, so Madison, if we don't have any more, we're gonna continue
We
and
do
we'll try
have
to answer. Okay,
a few questions about our vision coverage and plan. Let's
perfect.
see. Under the vision plan, to confirm, does glasses mean both lenses and frames?
Hello, this is Kim from United Healthcare. So yes, so referencing the benefit summary, so eyeglasses does cover lenses and frame.
Thank you, Kim.
And also in reference to our vision coverage, does the enhanced plan include special types of contacts?
Hello, this is Carmen. Can you hear me?
Hey, Carmen, yes, we can.
Hey, Kim and I are tag teaming on this. So any lens that is elected as far as contacts are concerned are going to be included in your contact lens benefit. Now, if you have a toric lens and it's due to a medically necessary situation, then that can be covered in full because some of those lenses can be pretty expensive. You just want to make sure you get pre-authorization before your visit. Just reach out to your provider and have them reach out to us to make sure that that's approved. But just about any contact is covered with your contact lens allowance that is provided under the plan.
Thank you, Carmen. Madison, should we proceed?
We have one more for now, I would say.
Okay.
Can we go over the change from 80 to 20 and 75 to 25? I believe she's talking about the last slide.
Say that again.
Let's see, she writes, can we go over the change from 80 to 20 and 75 to 25? I believe it was one of the last slides.
Wanda, this is Julissa.
Hi,
I can
Julissa.
Hello. I can clarify that question if I was not very clear. It's a question I asked. There was a mention in the chat about a change in the plan. I suppose that's PPO going from to 75-25 as a reduced coverage. And that was the first I was seeing that. And is that the case? Is that the case? I don't see it in the what's changing slides for 2021. Thank you.
Yeah, I don't know where that is referenced. Is it this slide,
Wanda.
Julissa? Uh-huh.
Wanda, it's Jen. I think they're referring to the co-insurance changing from 80-20 to 75-25. And the change in the co-insurance was a decision made by the executive team.
Right.
Including the county manager. So
Right.
there's
So
not really much more we can say other than, you know, that was the decision that was made for the health plan for this year.
Right. And I would just add that these changes were submitted or recommended by our outside consultant to help mitigate some of the costs, you know, the annual healthcare costs. we are self-insured. So that means that the county pays all of the claims. And so when we have a healthcare cost of what, 85, no, excuse me, I think it's up to 100 now, $100 million healthcare costs, and we have to pay for that. Well, we have to consider all options on how to mitigate the cost and how to, not make it so burdensome for employees, because this is a cost sharing event. The employees share in paying for the cost as well as the county. And this was just one of the ways, one of the options for the county to consider, and the county manager went with this route to increase the co-insurance.
Thank you, Wanda. I was trying to understand the change. I'm not questioning the decision. I'm just trying to understand that there is a change. So if I'm in a PPO and I have a $1,000 bill, it used to be paid at 80%. Then I paid the 20%, assuming there was no deductible. And now it's the county will cover 75% and I'll cover 25%, right?
Yes, ma'am.
Thank you so much. Thank you for
You're
that.
welcome. Okay, so let's see where I believe Madison, you said that was the last question, right?
Yes, for now.
Okay. So now we'll move on and we'll talk a little bit about our health clinics. Mecklenburg County cares about its employees, and so it has invested in employee wellness through partnership with Our Health. This is an independent provider of primary care clinics. Our Health provides access to near-site clinics, offering services such as primary care, illness and injury care, lab work, medication dispensing, and wellness services. The clinics are available to employees and their eligible dependents. One of the great things about the clinic is that it is exclusive to members only, meaning the clinics are not open to the public, so you're not competing for time or space with non-members. There are now 6 convenient locations throughout the Charlotte area. One is on 4th and McDowell, Albemarle Crossing, North Lake, Wilkinson Boulevard, and now Pineville Matthews Road, Tower Place, and Sycamore Commons in Matthews. They're open in the evenings, and at some locations, they're even open on Saturdays. Just remember, you must make an appointment. This helps with the wait time. I mentioned on the previous slide some of our health services. Here are some other services that are also available. I'll give you a minute to read over them, but I did take the liberty, excuse me, I did take the liberty of highlighting in yellow some services that you might find beneficial, such as biometric screenings, health coaching, flu vaccination, and notice on the right side of the slide, non-emergency illness or injury visits are $25 for those that's on the high deductible health plan, and no charge if you're on the PPO plan. When it comes to medications, the clinic can save members time and money. The clinics offer more than 140 frequently prescribed medications at little to no cost. Chronic condition medications at no cost. If you are on the high deductible health plan, acute illness medications are only $4. If you're on the PPO, it's no charge. They also have online refills and free home delivery. So, Our Health is a great complement to both medical plans. If I had to sum it up, I can give you 4 good reasons to visit the clinics. 1, high quality primary care. 2, little to no cost for service. 3, conveniently located throughout Charlotte. And 4, you can earn future My Total Health rewards, as well as earn wellness incentives for the 2022 by completing certain requirements. Are there any questions regarding the clinics?
Hey, Wanda, I did see one question in regards to the clinic's hours. Let's see, are the clinics other than North Lake open evenings or have weekend hours?
Miss Jenna with Our Health, are you with us today? Okay, well, Jenna was invited, Our Health was invited. She might have had difficulty, technical difficulty joining us. So I know there are, read the question one more time, Madison. I want to make sure I get it right.
Are there clinics other than North Lake with evening or weekend hours?
Oh, other than North Lake. Now that I can't speak to directly. I would refer you, that whoever asked that question, to go to Our Health's website to get specific information on the clinics that are open. I do North Lake is open on the weekends. I cannot speak for certainty if it is the only one, but I encourage you, please go to Our Health Clinic's website, and they have a lot of good information out there for the answer to that question.
Our next question, which is very frequently asked, are you eligible to take a prescription from your PCP and have it filled at Our Health?
So the question is, can you take your primary care prescription, your doctor's prescription, and fill it at Our Health? No. Actually, only Our Health is not a pharmacy. So if you were to go to Our Health, if the attending physician at Our Health prescribes something for you, medication for you, you can have that filled at Our Health. But no, you cannot take your prescription from your doctor and fill it at Our Health.
And our next question, does your My Clinic visit go towards the deductible if you have a high deductible health plan?
Does the Our Health Clinic visit apply to your deductible? And if you go to the Our Health Clinic, yes, it does.
And also, do the Our Health clinics offer telehealth?
Yes. Actually, that came in very handy during well, we're still in it, but you know, within this pandemic environment, yes. Jennifer, am I correct with that one? I know Blue Cross offers MD Live, but I think Our Health offers telehealth as well.
They do. They have virtual visits that can, sometimes they're video, and sometimes they can even just do an audio, just a phone visit. They offer both.
Mm-hmm.
Our next question, can you see a specialist at My Clinic?
A specialist. I do not want to comment on that because I'm not 100% sure. I know that they make referrals I don't know for certain if the specialist is actually there at the clinic.
Wanda, I'll try to help. So you wouldn't be able to see someone that is medically classified as a specialist. However, the doctors that are in the clinics can treat a lot of the things that you would go see a specialist for. So, you know, we don't want you to share your particular issues with us, but if you want to reach out later and, you know, let us know what particular condition you're looking for treatment with, we could let you know whether they could help. But, you know, they can handle many things that the dermatologist would handle. They can, what else? They can also do behavioral health. They can do lots of things that an ENT, an ear, nose, and throat doctor would do. So even though they're not classified as a specialist, they can treat a lot of the conditions that you might go see a specialist for.
Thank you, Jennifer. So let's move on for the sake of time, and we will talk about voluntary benefits. Some people refer to voluntary benefits as supplemental benefits. No matter what you call them, they're great benefits to have. What's great about supplemental plans? Well, number one is it pays in addition to any other insurance you might have. All benefits are paid directly to you. They're pre-tax. And because they are 100% employee paid, they're portable, meaning when you separate employment with Mecklenburg County, you can elect to keep your voluntary benefits. The county has 5 voluntary benefits you may want to consider doing open enrollment. They are cancer insurance, accident, medical bridge, and critical illness. These are provided through Colonial Life Insurance. Pet insurance is also a voluntary benefit provided by Nationwide. If this is something you're interested in, you'll have an opportunity to schedule a virtual appointment with a peers group consultant the first week of open enrollment. If you're only interested in pet insurance, you can just call Nationwide directly or visit their website. Open enrollment is a great time for employees to review or even update information in MyHR, like your personal information, your beneficiaries, and you can also review retirement supplemental plans, for example, the 401k, 457, and the 529 college savings plans. We've made a few enhancements to MyHR that I think you'll find helpful. Come November 9th, when you log into MyHR, you will see additional hyperlinks on the employee enrollment landing page. Keep in mind that when you click on the link, it will take you to the vendor site, and you'll need to come back to MyHR to complete your open enrollment process. Also new to this enrollment period is the opportunity for the school health nurse to electronically request a contract change form to change their pay from 10 to 12 months or 12 to 10 months. So when is open enrollment? Open enrollment is November 9th through midnight of November 20th. Remember, if you do not enroll or waive coverage, you will not have the insurance coverage, any insurance coverage for the 2021 plan year. Enrollment for medical, dental, vision, and flex spending account is done online via MyHR. To ensure your submission was successful, you should get an email confirming your elections. If you do not get an email confirmation, please call the Employee Services Center at 704-432-6947. And if you didn't get that number, don't worry, you'll see it again on the resource page at the end of this presentation. So what changes can you make during open enrollment? You can change plan coverage. Remember, if you were hired before January 1 of 2017, you can elect the high deductible health plan or the PPO plan. You can add and delete eligible dependents. If you are eligible, you can elect to participate in the dependent care or health dependent, excuse me, that's the flexible dependent care plan or the flexible healthcare plan, if you are eligible. You can elect to contribute to the health savings account if you enroll in the high deductible health plan. This year, you can review or make changes to your 401k, 457, or the 529 college savings plan. And last but not least, if you are a 10-month school health nurse, you can electronically request a contract change form. Here are some frequently asked questions. What happens if I do not enroll by the deadline? Well, you nor your dependents will have health coverage for the upcoming plan year. Do I have to enroll if I'm already enrolled in health coverage? Yes, everyone must enroll and select their benefits, even if you are opting out of the county's plan. Will I receive new ID cards? Yes and no. You will receive new ID cards for medical and pharmacy by the first week in January. However, you will not receive a card for dental or vision. If you need one of those, you can go to the carrier's website and print one off. If I elect not to participate in the county's medical plan, can I utilize Our Health's My Clinic? Unfortunately, no. Only employees and their covered or deemed eligible dependents enrolled in one of the county's medical plan may utilize Our Health's clinic. Can I enroll in the high deductible health plan with the health savings account and also have a flex spending health plan? IRS rules do not allow an employee to be enrolled in the flex spending health plan and the high deductible health plan. So I hope this session has been helpful. I would like to give the carriers that's on the line an opportunity to expand or speak on services or additional services, coverages that, that were not mentioned today. So if the carriers, our business partners, if you'd like to add to what has already been said, feel free to do so at this time before we get into the Q&A.
Hi, Wanda. It's Bill from CBS. I just wanted to touch on a question that has come up in prior benefit fairs and just didn't seem to come up today. I do want to remind everyone that just because CVS provides the pharmacy benefits, you can still utilize thousands of pharmacies outside of CVS. So any pharmacy that is in our national network, you can use and continue to use going forward. So I just want to make sure everyone knows that going forward.
Thank you, Bill. Yeah, that has
Thank you.
come up in several sessions. It just didn't come up today. But yeah, thank you.
Of course.
Anyone else? Blue Cross Blue Shield? All right. think that will do it. So what you have here on this slide is a list of resources, additional resources that are available to you should you have questions after you leave this morning's session. There's their link to their website as well as a phone number. Feel free to give them a call. And you can also call the Employee Services Center. I remember saying something earlier that you'll see the Employee Services number at the end of the session. Well, their number, 704-432-6947. So now we'll open it up to some questions and answers that we didn't get to during the break sessions. And Madison, do you want to read some of those questions to get us started?
Yes, I can. Let's see, I'm scrolling up. Are voluntary benefits pre-taxed?
Some of them are. The accident, cancer, medical bridge are. Pet insurance, I do not believe is, but if you would like more information regarding voluntary benefits, the Pierce Group is our broker. They are scheduling appointments the first week of open enrollment. I would encourage you to make an appointment with them, and if not, their website is very comprehensive. You can go directly to their website, and all of this information is in your 2021 Benefits Open Enrollment Guide. The guide was mailed to your home address, a couple of weeks ago, so you can find the carrier's name, number, and website. Pierce Group is also listed as a resource on the page here, but if you go to your open enrollment guide, it's in there as well.
Okay, let's see. I am scrolling back up. I do have a vision question. Let's see, if you have a medical diagnosis and require contacts, are you saying that if you get prior approval for the vision coverage, let's see, hold on, you read that over. If you have a medical diagnosis and require contacts, are you saying if you get prior approval, the vision coverage may pay for your contacts?
I'll take that one. This is Carmen. So under the normal plan, any set of contacts that you get, you'll have your contact lens allowance to put toward those contacts. There's a very small percentage of people who have, and I always pronounce this wrong, so please bear with me, but it's like keratinosis, something like that, and some other related maladies that have to do with their eyes, to where only contacts will solve their particular situation. Those are called medically necessary contacts. So the best way to know whether your contact fits in those parameters is to just talk to your provider and ask them. And what they would do is they just submit a form to us to get pre-approval to provide you medically necessary contacts. Those are for people who only contacts will work to take care of their particular eye diagnosis. In that case, we do cover, once approved, we do cover those contact lenses in full, and they can be quite expensive. They can be $1,000, that kind of thing. So that's how medically necessary contacts are handled. Anything else falls underneath the contact lens allowance.
Thank you, Carmen.
Let's see, do we need to re-enroll in the voluntary benefits if we're already enrolled?
I will take that. If you are already enrolled, you don't have to do anything, but because there may be some changes, I would strongly recommend that you make an appointment with your, with a peer group consultant to go over those changes, if there are any.
All right. With the HSA account, does the amount that an employee contributes earn interest?
With the HSA amount, wow. Do we have Blue Cross on the line? I don't feel comfortable answering that one. I do know that it is in a tax advantage account. I could say that with certainty. Interest,
Wanda?
I'm not that sure about. Yes.
Hey, Wanda, I can answer. Madison, did they ask which one, the FSA or the HSA?
HSA?
Does the HSA accrue interest? Is that what the question was?
Yes.
Yes, the HSA accounts can accrue interest, and Health Equity can provide them the exact details on it. FSA account funds, according to IRS rules, are not allowed to accrue interest.
Thank you, Jennifer.
Mm-hmm.
Our next question, do flex benefits carry over?
No, flex, and let's be sure and clear. Flex spending account, here's what I'm going to clarify. Typically under a normal year, not the pandemic year, that would be, the answer would be no, the county does not allow flex spending account rollovers. However, this year, as a temporary provision due to COVID, a temporary provision, the county, as well as the government, has a $550 rollover amount, but that's temporary.
Okay, our next question, will you define coinsurance?
Okay, yes, I will. Coinsurance. Okay, I'm going back. I'm not sure if you're still on the line. I'm still on the Zoom session with that. But here, this will, a picture is usually worth 1,000 words. Okay. So, coinsurance is that cost sharing, is that amount, depending on what plan you're in. Let's go with the health savings, with the high deductible health plan. There is a co-insurance until you reach the deductible. That is the amount that is shared. You and the county share in that and paying healthcare costs. The co-insurance for the upcoming year will be 25%, and the county pays 75%. So that is a cost sharing amount until you reach the deductible. And then once you reach that deductible, once you reach the deductible, depending on whether you're in the PPO or the health savings plan, once you reach the deductible, then you go into an out-of-pocket max. But the co-insurance definition is the percentage of the cost that you must pay to meet that deductible. And for 2021, it is 25% your cost and 75% the county's cost.
All right, our next question, is the county looking into getting other My Health Clinic locations other than Mecklenburg County?
Because Our Health is an independent provider, they are the decision makers in determining what clinics they open and where. Our plan, you are restricted to utilizing clinics within the Charlotte area. They do have clinics outside of the North Carolina area, But because of our plan, you are restricted to only utilizing my clinics within Charlotte.
Our next question, when are the 2021 plan year HSA funds available?
They are available January 1 of the plan year. So during enrollment, open enrollment, you make your election. The election and coverage doesn't begin until January 1 of 2021. Funds, the seed, the employer contributions should be available in your account January 1.
Our next question, what is the 2021 high deductible health plan for the family plan?
Read that again, Madison. What is?
Yes, the employee writes, what is the 2021 high deductible health plan for family?
Madison, do you think she means what is the deductible on the high deductible plan for family coverage?
I'm assuming yes. She writes yes.
Okay. Let me turn to that page.
So the question is, what is the deductible? I'm sorry, read it one more time, Madison.
What is the deductible for for family coverage on the HDHP? If that is indeed the question, the answer is the deductible is $3,200. Did that answer the question?
It did.
Okay, great.
All right, and our next question, how long can the flex money be used? Is there a deadline in 2021?
I'll get this one.
Rollover flex money.
So if you have a flex spending account for the 2020 year, and at the end of the year, December 31, there is a balance. If that balance rolls over, you can roll it over for the 2021 plan year. Claims, you have until March 15th to file for services or file claims for services that you incurred in 2020. So 2020 services, you can file claims until March 15, 2021.
Wanda, this is Sherry. That is for the flex medical only,
Right.
the rollover.
Right. Thanks for clarifying, Sherry.
All right, and our next question, if one has historically used the PPO plan and changes to the high deductible plan, can they go back to the PPO plan the following year?
If you are one of the grandfathers, if you are one of the grandfathers and are fortunate enough that are eligible to participate in the PPO, yes, you can change the next open enrollment year to go to a high deductible health plan and vice versa. So you have that option. Now, you lose that option if you were to separate employment with Mecklenburg County and you come back as a rehire, then you lose that grandfather status.
All right, our next question. If hired after 2017, can you explain again what plan an employee can select, PPO or high deductible?
If you were hired after January 1 of 2017, your only option is the high deductible health plan. And honestly, when you go into enroll in my HR for open enrollment, we've taken care of that. You will only see the high deductible health. You'll only see what you're eligible to participate in.
No further questions.
Great. Okay. So if there are no further questions, we have our carriers with us. Feel free to raise your hand. Madison can see you. Or you could put it in the chat. This is your meeting. We have until 11:30, so take advantage of this opportunity. All right. So Madison, no more questions in the chat box that we need to address?
Well, we do have two questions. One employee was asking about Colonial. I don't believe we have a representative.
If there are any questions regarding voluntary benefits, the opportunity to ask those specific type of questions is with your peers consultant, peers group consultant. So there's a link on my HR where you can sign up for an appointment with the consultant. Please go visit my HR, MacWeb. Take a look at the appointment schedule and talk with one, because these are great benefits. Like I said earlier, great supplemental benefits that can complement our medical plans.
Our next
All right.
question, we have three more, I believe. What is the amount covered for contact lenses?
Hi, this is Carmen. It's $130 for both the standard plan and the enhanced plan. Wait, I'm so sorry. I was looking at the frame. That is my bad. It's actually $150. So sorry about that. $150 for both the standard plan and the enhanced plan.
Thank you, Carmen.
Thank you.
Our next question is the plan for Mecklenburg County to transition all employees to the high deductible health plan at some point?
I cannot say, Jennifer, I'm going to go out on a limb. I have not heard of any discussion at the plan level or at the executive level of such a event or such a task. I don't know. These are plan design changes that we make that we evaluate and review year after year. So at the moment, there's been no discussion about that I am aware of.
Wanda, I would agree with your answer. Right now, I am not aware of any plan to eliminate the PPO completely. However, as Wanda said, the benefit decisions are made each year.
All right, Madison, I think that will do it for us.
Okay, we do have one, let's see. Looks like Ms. Butler has a question about FMLA. I will probably send her over to the ESC. And one clarification question, it says the enhanced vision plan can only be applied to glasses or lenses or contact lenses, not both. Is that correct?
UHC,
Sorry,
did
I
you
muted
understand
myself.
that?
So sorry. This is Carmen. I muted myself. I apologize. So I'm not sure if I completely understand what's being said. So I'll just say both plans have a 12-12-24 frequency, which means that every year you can get contacts, or every second year you can get frames. But every year you can only get one type of material. So you can only get contacts one year, or you can only get frames every other year, and those frames include a lens. And you guys have a fabulous plan where a lot of those additional lens coatings and types are included on the plan, but you can't get frames and contacts covered 100% on the plan at the same time. You have to choose one type of material every year, and just keep in mind that frames can only be chosen every 24 months. So most members will get, if they wear contacts and frames, they'll get contacts one year, and then they'll get frames the next year, and then they'll go back and forth like that.
Great. Wonderful. Lots of great questions. Good questions.
This is Johnny Butler. Can you hear me?
Yes, go ahead, Johnny.
Yeah, I didn't know like if my question was appropriate or not, because it seemed like that this presentation is more based on just explaining, you know, the insurance base. And I kind of want to talk a little bit about that, or see if you guys could give me more direction on that, because I am pregnant. And so I wanted more information on the process and how that works and what would all be needed. I thought this presentation was going to incorporate a little bit more of that, but it didn't. So if you guys could just give me, you know, a person of contact or point me in the right direction, I would greatly appreciate it if you guys have any information that can help me in that right direction.
So Johnny, are you the person that asked about the family medical leave?
Yes.
Okay, so Madison, I believe Madison said that she's going to send you through chat, or we could send it through email, but I think she was going to respond to you with a contact who you need to speak with about that.
Yep, I just see her, I just saw her chat email. Okay, thank you so much. Thank you, Wanda. Thank you, Madison.
You're welcome. Okay, so we will conclude this morning's Zoom session, open enrollment session. I want to thank all of the participants. I want to thank my business partners for helping answer your questions, and just keep in mind there are lots and lots of resources that are available to you. We sent you all the open enrollment guide to your homes. We also have the benefits virtual fair that is on MacWeb. Please go ahead and check that out. You have an opportunity to schedule an appointment, a virtual appointment with a peers group consultant to talk about the voluntary benefits. So we have lots and lots of information out there. Again, don't miss the open enrollment window. That's the purpose for this whole session, is to remind you that you have a short window, lots of information, but also lots of resources. So again, thank you all and have a great rest of the day. If Madison and my business partners, if you guys can hang on just for a little bit, I'd want to get an idea of who's going to attend the afternoon session. So hang on just for a second, okay? Everyone else, have a wonderful day. Thank you for participating. Bye-bye. Madison, I'm going to